evaluation. So with that, I'm going to turn it over to Shanta and Xavier.
Hello everyone, my name is Shanta Jackson. I am a health educator with Southern Nevada Health District's Teen Pregnancy Prevention Program. It's a new program that was just funded within this past year. And we're going to talk to you guys today about the benefits of process evaluation. And
Good morning, everybody. My name is Xavier Foster, also a health educator with the Southern Nevada Health District's Teen Pregnancy and Prevention Program. Like Shanta mentioned, today we're going to be focusing on the benefits of process evaluation while implementing a teen pregnancy prevention strategy. Okay? If you have noticed, I've been blessed with this exotic accent, so also curse, you know. So I'm going to take my time and make sure that nothing gets lost in translation. Okay? Okay. So what Southern Nevada wants you to take back with you to your organizations and your agencies is an understanding on the importance of process evaluation for program sustainability and future funding. So we're going to do this today through a description of how we use those processes in the implementation of our program. Today's agenda is going to include a brief overview of our program and the program description. We're going to talk a little bit about what evidence-based programs are, and we're going to talk about the goals, the methods, and some of the results we achieved under our evaluation plan. Okay? We're going to share with you some of the lessons we learned during the process, as well as providing you with some helpful recommendations at the end. Okay? So, through the U.S. Department of Health and Human Services, Southern Nevada Health District was awarded a 5-year grant to implement a replication of evidence-based programs that target teen pregnancy prevention. Of the 28 programs identified by the CDC as evidence-based, we chose Be Proud, Be Responsible, and Cuídate, which stands in Spanish for take care of yourself. Okay. Be Proud, Be Responsible was originally designed to target, or was originally designed to be targeted towards African American males, young adults. The purpose of that program was to reduce the HIV transmission rates in that population. Cuídate is a cultural adaptation to Be Proud, Be Responsible, in which Hispanic Latino males are targeted through the use of Latino cultural values and beliefs to address those behaviors. It's important to note that we are through this program and teaching kids how to use condoms effectively and to delay sexual activity, we are trying to achieve our goal of reducing teen pregnancies in Nevada. So what is an evidence program? I've been talking about them. I have said that phrase now like 10 times. And they're nothing more than programs that have gone through rigorous scientific research and evaluation. They have been determined to be effective, and therefore they're recommended for widespread use. So if you already know the programs are effective, why evaluate them? Well, this point talks directly to our implementation. We want to make sure that we can reproduce the same positive results they did in the initial evaluation. So that's why, for example, Be Proud, Be Responsible, and Cuídate, they were both implemented with the general population in school and community settings. Our implementation is with high-risk youth, and I'm going to talk a little bit more about it, where we implemented our program in the detention and probation centers and in foster care. So why implement a teen pregnancy prevention program in Southern Nevada, rather than, let's say, tobacco or drugs? Well, Nevada ranks #2 in the nation when it comes to teen pregnancies. In Clark County, we represent 72% of the state's population. So therefore, we shoulder most of those teen pregnancy cases. Okay. Through data collected, you can't see it that well, but through data collected, we identified 7 high-risk zip codes that represent 23% of the teen birth rates in our county. Therefore, we came up with the selection criteria for our program, which include African American and Hispanic Latino males and females, ages 13 through 18, and they must live in those 7 targeted zip codes. Okay? Okay. So no program implementation can happen in a vacuum. We need partnerships with other community providers to make sure we achieve the goals that we set forth. So therefore, our leadership in the organization forged really important relationships with the Clark County Juvenile Justice Services and the Department of Family Services. The partnership with Juvenile Justice allowed us to facilitate the curriculum in 2 sites. The first one, detention, where we facilitated the curriculum to young males ages 13 to 15. We targeted the older males 16 to 18 and the females 13 to 18 in the pods. Okay, in prevention, we implemented the program in 2 sites. We identified 2 of the prevention centers that serve the population we identified. So we have one on the east side of town and one on the, is that the west side of town?
Yeah, like
the west side. The west side of town. In detention, we facilitate or provide the curriculum in 3 consecutive days, and each day the kids get 2 hours of intervention. Okay? Information, we do co-ed groups, and the age for those are the 13 through 18 age range. With the Department of Family Services, we were able to provide the implementation in 2 venues or modalities. For one, we were able to attach the curriculum to the Department of Family Services classes for independent living. These are kids that are getting ready to exit foster care, and they go through a series of 8 days of training, and we were able to just tack on our curriculum to that so they will get back. And we also implemented the curriculum we did standalone classes in 2 of the family services centers for DFS. Well, before that slide, I also wanted to note that although we provide the curriculum to both females and males, our primary intended target population are males. Okay? So I hope this brief information I gave you an idea of who we are, what we do, why we're doing it, and now we're going to move to the section where we talk about are we doing what we're doing effectively. Okay. So no program, no implementation is effective without measurable goals. You want to make sure that you're on track and that you are accomplishing what you set out for. So these are some of the monitoring goals and evaluation goals that we set forward in our plan, which include to make sure that we are, or to determine that we are implementing the program in an accurate and the intended way. We want to identify any variations in the facilitators, or how the facilitators implement the information without changing any of the core elements of the program. Okay? We want to identify any successes or failures. That way we can guide any change for future implementation or address issues while they arise so we can take care of them right away. And lastly is just to get a clear snapshot, a financial snapshot of what the actual costs are for the implementation of the program. Okay. So this graph illustrates the steps necessary in process monitoring and evaluation activities. We have established a measurable objective which takes place during the planning process. Okay? Then during the evaluation process, we want to identify questions of interest, we want to identify indicators, and identify sources of evidence. So what does this mean? For example, one of the target values that we had was participation. Okay? So if you take participation, then we want to know, the question will be, how many participants do we have in our program, or how many participants completed the program? Okay? Then we have the indicators. So for that value, the indicators will be the information that we collect throughout the implementation to make sure that we are reaching our goals. And lastly, it will just be the tools used for the collection of the data. So for example, the question is, how many participants completed the program? The indicators will be the actual data that we collected, and the tool will be used will be the sign-in logs for the participants. Okay. These are the target values that we measure throughout the implementation, including budget, participation rates, retention, demographics for our target population, the fidelity to the curriculum, and facilitator and participant satisfaction. And this one, I'm not going to read all this information. Shanta will go over those a little bit later. But these are the objectives that we have for our plan. We wanted to make sure that we completed the pilot phase on the budget or within budget. We want to make sure that we completed all the work plan activities and objectives that we set forth in the plan. We wanted to achieve a 95% rate of participants that were referred to us for recruitment, and we wanted an 80% participation completion goal. Okay? We wanted, of course, to achieve all our target or reach all our target population. We wanted to make sure that the curriculum was delivered with 100% fidelity and achieve a satisfaction rate for participants and facilitators at a 90% rate. Okay? Now we know.